Houston Speech and Hearing, which was an entity that was affiliated with UTHealth Science Center at that time, had a lead-lined van that they didn't know what they were going to. It had become obsolete. They didn't use it, and they were going to sort of relinquish it. And for some reason, they called me and wanted to know what would we do with a lead-lined van. I said, well, I had no idea, but I'd always thought that one day it would be nice to actually try to deliver care along the Texas-Mexico border. We'll actually refurbish this van and turn it into a mobile clinic and drive it down to the valley and set it up.
Some of our patients don't have access to a car, they don't have transportation to get to a clinic, so it helps us being out in the rural areas so they can get, services.
The van will go from colonia to colonia. It'll spend a month or two in one colonia, take care of the medical needs as perceived there, then move to another and another. So that way we can continue to deliver care to a variety of spots.
The program is perfect for us because we have some insurance that it's a very high deductible. Every time that we need to see the doctor, no longer than 3 days it'll take to take us. So we brought him in and we're like, oh, it's just a regular flu. We're not gonna think anything of it. And then when they checked him, they say he's positive. So we need to put him in this medication. And we were like, my jaw fell when I found out my son was sick of that, because I was seeing in the news left and right people dying. So it was very good that he got caught on time. And he's alive, he's fine, he's 9 right now, so.
We do immunizations, we do finger sticks, fasting glucose and cholesterol. We check for anemia. We can also do, like, if somebody's complaining of a urine, discomfort, we can do a urine analysis to see if they have an infection. We can run strep or flu tests to see if they have, a virus, bacterial infection. And we also do pap smears for women 21 and over.
So the telemedicine component is helpful to assist our physician assistant, who is actually out in the field on the mobile van in a lot of the colonias in the valley. So he's outside the Brownsville area. So if he has a patient that maybe he has a question about, a patient that he wants me to look at something, he will dial us up. We're here in Houston and he's in the valley, and we can consult the patient. But not only do we just talk about the patient, I can actually talk with the patient. It allows me to ask the patient questions. It allows me to actually examine the patient virtually. So we are able to look in the ears, look in the mouth. If there's a rash, which when we have a lot of younger patients, especially because we're parked outside of school, so we tend to get a lot of pediatric patients. So having the dermoscope, which will allow us to magnify the skin and look at rashes, is really, really helpful. If you're not quite sure, if he's not quite sure if somebody looks like they have an ear infection, we're able to look in the ear, and so that's helpful as well. So what it allows Paul to do is to get a consult from all the physicians who work here that are affiliated with the mobile clinic are board certified in both internal medicine and pediatrics. So he's able to get a consultation from myself or one of my colleagues about a patient that he has a question on.
So what we've done with the van is to say, how can we expand its effect? And so we've added a delivery system reform program and put some promotoras with the van who will go out and start to screen people for chronic disease and other issues, and then bring those people in to see the physician's assistant. It's not just navigation to a clinic, but we may navigate them, if they have diabetes, into one of our programs for lifestyle change. So the promotors can do a lot of navigation, not just to a clinic.
There's also programs that they offer us, like for dietitian and for exercise. It opens my eyes of things that I didn't know, that I didn't get taught. There's not a lot of people that have that means of money, or people that are educated to know stuff that you say, oh well, that's like common sense. There's a lot of people that don't know that that's common sense.
I think we've won the hearts and minds of the people down there. They trust us, they know us, and know that we're going to deliver the very best care we can at no cost.
All right.
Thank you, whoever.
Thank you.
Thank you, whoever decided to put this program out here.